Hello, and welcome to Documenting for a Patient with Insomnia. I'm Dr. Hizon, and we'll be talking about how to document for a patient with insomnia. As a general disclaimer, please refer to your particular doctor. This is a general course, not intended to be medical treatment. Your particular situation may vary. So insomnia is basically a sleeping disorder with difficulty either falling asleep or staying asleep. So you can talk about initial insomnia versus terminal insomnia. You can wake up during the night, you wake up too early, not feeling rested after you sleep, multiple things that can have a patient less than optimal type sleeping. On the physical exam, we'll be looking for underlying medical conditions, especially in the neurologic exam, and typically on the history, we'll also look at review of systems and review their sleep hygiene. We'll do a history physical. Usually there's some labs are done if there's some medical conditions suspected, and maybe some imaging might be done. The treatment can be over-the-counter type medications and prescriptions of medications if indicated, and we may do some consultations. Usually it's lifestyle medications. Usually we're going to be giving them a good sleep hygiene routine to do. There's medications like Lunesta, Ambien, those sorts of things. There's other treatment type therapies, as well as even referrals, even to sleep specialists and even to dentists if there is a problem with the mouth, and or pulmonologists if there's a problem with the breathing, something called sleep apnea. So usually with lifestyle modifications, we'll talk about obtaining your ideal body weight, maybe some exercise, reduce stimulants at night, avoid alcohol, and maybe stop smoking. Other times is medications, other treatments, as well as follow up with the primary care medical specialist and or other specialists. So undocumented for the patient with insomnia, a typical chief complaint might look like this. A, say, 42-year-old female complains of inability to sleep for the last, say, 30 days. And then this would be a type of template you might use. So as a 42-year-old female with maybe a history of diabetes presents today for complaint of sleep difficulties that have occurred for 2 months. And then you could say when it started, the context, and then other details of her and sleeping. Do they have any symptoms such as falling asleep or waking up? And just go through the details of their sleep history, and then provocation. What makes it worse? Like if they drink too much, does that make it worse? And then what makes it better? Say they get a good exercise and avoid a lot of stimulants at night. And then do they have problems with snoring especially? And then is there any tingling? Do they have any pulmonary conditions? How about dental conditions? And you go through, have they had previous workups? What have they done so far in terms of medications? How are the labs in the past? And have they seen any specialists like a sleep clinic, pulmonologist, or cardiologist? The past medical family social history, look at tobacco use, exercise, nutrition, and then obviously we're talking about their sleep program. And constitutional symptoms, especially have they gained or lost any weight since the last time we saw them, and go through the review of systems point by point. On the objective, you get a general overview statement. You'll look at cardiovascular, you look at pulmonary, and you'll look at abdominal, but especially look at their neck and overall body habitus. On the assessment and the medical decision making, is it a simple or complicated case, and does it require straightforward or complex decision making? And this is the time for the provider to give reasons and rationale for why they are treating in a certain way. ICD-10 codes, it's a G code is insomnia, G47.0. There's G47.00, which is unspecified insomnia, and then there's other kinds of insomnia. If they have problems falling asleep, that's primary insomnia, that's F51.01. And then insomnia due to a medical condition is G47.01. Plan, usually it's medication, maybe some other therapies, specialty consultation, and follow up with the primary care medical provider or specialty provider. So pearls and pitfalls of documenting for the patient with insomnia: document all symptoms and duration, past medical chronic conditions and procedures that they might have done, maybe family history and their own self-history of sleeping and breathing disorders. Learn the various questions. Please do not hesitate to ask your physician or provider if you have questions about documenting for the evaluation patients with insomnia. And be careful, and importantly, make sure you document quality measures for the patient in terms of prevention. So takeaway points is that insomnia is a common sleep disorder. Treatment requires the patient's detailed and accurate history of the present illness. It's important to rule out any differential diagnosis or other things that could be causing the insomnia. Study hard to learn the various questions to ask, such as the accurate history of the present illness and exam. Learn required sleep health questions to assist the provider in documenting. And as always, while doctors save lives, we thank you, medical informatics specialists and scribes, because you save us doctors. Thank you.